So we are doing a study at Stanford, which is funded to look at agency systems in the very, very poor. It turns out that agency is a very interesting model where it is the ability for a community or a person to act. And people who are caught in poverty traps are impoverished in that currency as well, agency. And so what we are finding is that if you give them a certain kind of way of discovering that they have an innovation capacity, they can turn very quickly. And suddenly people who had not even looked at it, they looked at something and even thought of it as a problem, because even to problematize a situation is actually a precondition. For that you need a precondition that you have agency. Otherwise you don't even see it as a problem. But once you know how to solve it, then you see problems all around you, and you also have the confidence that, oh, it takes a fair amount of exploration, but between us we will solve it. So it's a really fantastic, way of intervening with the system. It's a very deep way of intervening. Well done.
All right.
Where are your teammates?
We are here. We have your back. We have your back. What we'll do is we'll hold it up, I think. Right? This is sort of a unidimensional.
Learn is the challenge. So what we are thinking is we designed a community-based curriculum so that it can be used by the students, so that in the meantime when they learn, they'll get money out of it. So that's the whole essence. So what we are planning, or what we try to put is as a prototype, is we are having controlling government and local authority, and we are having a community-based education center, and we are having private sectors which are giving the support, and with supply with money. And all right, sorry.
No, we can point. Keep going. Don't worry about it. We can point. Yeah. Okay, so there's the government that he's talking about up there.
Yes. So the government or an authority is there, and then we have a community-based education center, and we have private sector which are giving supply and many support. So as you can see, all the green arrows are the transfer of money, and the white lines are indicating you the education or the learning process. So when the student wants to apply for that community-based program, he will apply to the community-based education center, and the student will be engaged in the program, and that's in isolated health or in selected prioritized health problems will be identified, and that's the target of education. So what they are going to do, the student will learn in the process with the support of trainer who is a professional in that specific field, who has got full support from the community-based education center, and in the meantime the student will learn from the support from the trainer, and in the meantime he will be participating in solving the health problem of the community. By then the money will run from the health as a promotion, at getting the support from the community. The community will have their own inputs into the government, which runs to the community-based education program, and the other is the donating or private sectors and others will supply to the community-based education, and the business will run in this pattern. And in the meantime, the students will learn and earn in the process.
Okay. Okay. Any comments? Anyone? Yes.
Is this money heavy?
Heavy money?
How it is on the funds? Is it more things?
It's about evaluating the viability, the practicality of under what conditions would communities pay for services to a student who could also use that income to earn, to learn and become more professionally solvent. And I think the process of our work together suggested that this kind of model might be more viable for the breadth and depth of a particular social or economic problem. For example, spraying for insecticides, right? For mosquito nets, right? Indoor residual spraying is a practice that's it's being privatized in Uganda. Communities will pay to have their areas sprayed, but you would have to have, you know, a particular problem that has a rather profound demand, right? I think to easily do this. I mean, another example might be the retailing of authentic seeds and inputs, agricultural inputs, to small retailers, right? Village retailers. But it's not going to work for everything. Yeah.
Just to add, the other thing that we thought about is about you need to have a certain type of problem that will have enough demand and enough clients for you to actually be able to make it work. So if it's agriculture, we know how much agriculture in Uganda would work. If it's a specific type of health problem like malaria, we know how much it's a big problem here. So you can't do it with everything, but there is enough kind of you know, problems that can be used for the model to work.
A question. What is the feedback given by the community-based education center to all these stakeholders? Because they are investing for this particular activity. What do they get in return? Is it simply sending money or resources to this system, or is there anything which is coming back to the system that clearly indicates that this is properly handled, or the objective is achieved for which this is established?
So at the start of the problem, we said that the community would identify what the problem is within their own area. So by solving that health problem, the community-based education center is actually providing a service to that community, if that makes sense. So the problem has been identified by the community. And so the solution that the community-based education center is providing through the students and the health professional is what it's getting back, if that makes sense. So the two kind of work hand in hand.
Yeah, it makes sense, but I don't see any reporting back to the system, because that is the way you can warrant that whatever has